So in this video, I'm going to talk you through why you should be revising the following subjects if you're sitting the AKT in January of 22. All of these topics are from the RCGP AKT Feedback, which is released basically when the exam results of the October AKT are released. And I'll pull up the document now. So you can find the document if you go onto the AKT main part of the RCGP website, okay, and it will see here the AKT feedback reports. And now I've already opened it up. This is the AKT feedback report. And what it does, it goes through how well people have done, what areas. Now the bit for you that I would strongly suggest that you revise is the areas causing difficulty for candidates, okay? And what I've done is I've just pulled all these out and put them as bullet points, and we're going to expand upon them in this video just to give you a couple of pointers about what you sort of think about it. And not only does this give you feedback for that particular exam, it also gives you a global feedback for the past year as well, okay? Now, I can't guarantee that these will be on the exam, but the logic dictates if going to have a retest or to sort of give you a particular question, it's going to be on this area. So it's worthwhile spending a bit of time. So that's where we get these from, okay? So we're going to talk through them. DMARDs, okay, disease-modifying anti-rheumatoid drugs, okay. First, you need to be very confident in dealing with, or at least being aware of, what the most common DMARDs, and I've just chucked a couple on the slide there, okay. From my point of view, I had a look at that, what bloods you should be doing, at what intervals, okay, and more importantly, why. And the real bit is, if you get a certain blood result of the full blood count is now this neutrophils are doing this, what are your immediate actions? Okay. Now that is really covered very nicely in the CKS. Okay. And it goes through in very, very easy language to give you a broad overview. Okay. Finally, shared care agreements. How do you safely transfer care of a patient on methotrexate, for example, from secondary care down to primary care? What's safe and appropriate and what needs to be handed back to secondary care? Menopause is a huge topic, and it's interesting that there has been media sort of like more pushing out about it, and so actually it's worthwhile just making sure that you're confident with it, looking at the signs of menopause. When do you just test in terms of a follicle stimulating hormone, and when do you just treat, making sure that you're confident with that? What are the alternatives to HRT? And basically having a rough idea of what to commence, and more importantly being able to counsel about the risks of it. And do not forget that they may need contraception up until a certain point. What contraception do they need? What is safe to give? What do you need to sort of factor into this? Menopause and dealing with menopause is quite a tricky, and it's a vast subject, and there are different courses, and you can lose yourself down a rabbit hole. My biggest recommendation, if you haven't done so already, is to get a Red Whale subscription. Their menopause and HRT guidance is second to none. I cannot fault it. What they do is they'll take a whole load of different guidance and condense it down to make it really, really digestible and easy to read. Likewise, I'll flag up a website called Menopause Matters, menopausematters.co.uk. Again, a great website to give to your patients if you're counselling them on HRT and all things menopause related, because not only does it go through HRT and the risks there, but it talks about alternative therapies that they can get, say, from over the counter, that they don't have to involve you about. So it's well worth sort of having that knowledge and having a look at that website yourself, because there are some professional elements to it. And of course, hammering home CKS. So the neurology red flags, I thought, wow, that's, even now I'd probably struggle with this, because again, the delay in diagnoses for some of these is really quite significant. But regardless, having a look at severe conditions, and so I'd make sure that you're aware of how brain tumours may present, okay, and certainly having a look at headaches and what your indications are for CT or MRI or referral into secondary care. Certain other conditions, multiple sclerosis, Guillain-Barré syndrome, just sort of popping up in the head, and not forgetting your basics. You need to be able to nail your stroke and TIA management. Asthma, I'm sorry, I have very, very little sympathy with this one. asthma is so incredibly common that you need to be very, very confident in doing this. And I would look at this in 3 different tacks, okay? You need to make sure that you're happy to manage a stable asthmatic. How do you step them up and down from treatment in both a child and adult, and how that may vary. And likewise, if you're managing an acute exacerbation in both children and adult, I would strongly recommend that you have a quick read through a report called Why Asthma Still Kills, as that will give you some really good knowledge and really good guidance about how to deal with asthma for it. But again, this is one of the core conditions that you really need to know about. So the fact that people are still getting it wrong means that you just make sure that you're happy with sort of the depth of it from there. They talk about the children and ENT, and the only bit that I sort of have a looking at was talking about hearing loss. And I'll leave a link here and I'll sort of flag it up to the actual website that they give some really good sort of guidance about how you follow up children with certain hearing loss from that point. Likewise, looking at the longer term views, just again, your safeguarding training, just make sure you've had a look at some of that. What are the signs of NAI that may present in primary care? What things are you happy with? Aren't you happy with? What can you document in your consultation to make sure that you're covering self safely? And also, how should you be following these children up in terms of raising appropriate concerns to whom, both within the practice and external agencies, thinking about social services, police, if needs be, paediatricians, and also things like that. Okay. It talks then sort of about Gillick and Fraser guidelines. Okay. Now, just making sure that you are confident and happy that these are, even though they often overlap and there is a lot, they've stemmed from the same case, but actually there are 2 distinct bits, okay? Whereas if you're Gillick competent, that you can gain consent and you're under 16 years, that you're able to demonstrate capacity clearly, okay? Whereas Fraser guidelines is just for contraception for girls who are under 16. That link that I'm sort of chucked in there is really useful and gives a very nice 1-page summary. And again, make sure you're happy with it, that you've read it, and that you can sort of regurgitate it as you need to from that way. So just a brief outline of having a look at the AKT feedback form, what I've pulled out from it, and thinks that if you are lost and you've got your AKT looming at the end of January, that if you're stuck for something from the clinical stuff to revise, okay, make sure you've ticked these off your list first. Okay, please leave a comment below if you found this useful. Okay, and likewise, if you're watching this and you've sat the exam, I'd love to know if actually any of these cropped up. Okay, Dr. Dave Hindmarsh, GP Templates. Good luck.